Everybody's looking at the time now.
Yeah, we have teeth mark on time. You have teeth. This thing. Anina will say, I don't have this problem.
There is nothing in between.
Nothing in future. I cured from root cause. Yeah?
That texture around the tongue increase in the morning or not? Go to the next.
Yeah, sometimes it's increased in the morning. This one. Can you see this one?
Yeah.
Hello. Can you see this one?
So this is sides there.
The sides.
Yeah. Quite big. What is this tongue called?
Teeth mark.
Teeth mark.
It's also kapha, no? Because the white coating.
Yeah, that will come.
This is kapha.
No,
No, it's
I'm
vata.
just talking about the vata, but in one times there are multiple dosas sometimes in balance because of the different organ, different dosas. Okay, so teeth mark is comes when there is a dryness in the spleen. When there is a dryness, high vata in the spleen. The spleen is playing one very good role to build mucus layer. What is the spleen doing?
Building the mucus layer.
Build the mucus layer. Second, for your immune system. For
Which you
lymphatic
say is
system, right?
white blood cells.
Yeah, for lymphatic system. The third one, spleen is playing very good role to absorb minerals. To absorb. Liver is functioning more to absorb vitamins, and spleen is functioning to absorb more minerals. Like exactly same, the left kidney is filtering your vata and pitta, right kidney is filtering your kapha, right? Left kidney is filtering more acids and fluid, na? Sorry, acids and gas. Right kidney is filtering more fluids. Same, the liver is absorbing and assimilating more vitamins. Okay, and your spleen is functioning to absorbing and assimilating more minerals. Okay? Okay? If there is a teeth mark in the spleen, means there is a little bit high vata in the spleen, right? High vata in the spleen.
It's a teeth mark?
Yeah, teeth mark. Yeah, it's a little bit high vata in the spleen. Whenever there is a high vata in the spleen is not able to absorb. Spleen is not able to absorb mineral which is the absorbing in the vata positions. For example, there is different mineral absorbing. Someone is absorbing with the liquid, with water. Something is with oily thing, right? So the same thing. When in spleen there is a teeth mark, zinc, Z-I-N-C,
Zinc.
zinc. How to pronounce it?
Zinc.
Zinc. Not zinc, right?
Zinc.
Zinc. So zinc is not absorbing, and the second one is little bit of the magnesium,
Not absorbed.
not absorbing.
So that will cause the teeth mark.
Okay. If you see the Chinese traditional Chinese book and they will say spleen chi deficiency. Actually, I don't know what is spleen chi, because water also chi, acid also chi, vata also chi, but which chi is deficiency?
If
Energy comes from vata, pitta, kapha, all.
can it mean that there's a lack of the minerals as well as a lack of absorption?
Yeah, yeah,
Like
of
if the
course.
minerals aren't there, you won't
Yeah,
absorb
then
them.
there will be zinc deficiency and magnesium. Okay?
Okay.
So in these conditions, what happens when we have the zinc and calcium deficiency? When we are lying down in the teeth, we have calcium, magnesium, zinc, right? In the teeth,
In the teeth.
we have these all minerals. When we are lying down, so our tongue will go more close to teeth and try to absorb more this mineral.
Oh.
Okay, so if they having like a spleen vata, but if there is no teeth, then don't expect teeth mark. Okay. When the person is lying down, tongue is going more there, and attached with the teeth and trying to absorb the zinc and the magnesium.
That's why they have teeth.
Yeah. So full night tongue is fully like pressed with teeth. That's why they have the teeth mark. Okay. अब ऐसे मत बोलना कि छोटे बच्चे हो गए उनको टीथ मार्क होगा जिनके टीथ आए ही नहीं है।
अभी आपने बोला था कि जिनके दांत नहीं है उनके टीथ मार्क नहीं होगा।
नहीं, मैंने बोला कि जो बड़े हो गए दांत गिर गया उनके टीथ मार्क एक्सपेक्ट मत करना। फिर आप बोलो बच्चों के
So-
इतने भी नहीं हुए हैं।
So when they're grinding their teeth, they're breaking down the teeth to absorb it, minerals.
When like this same, when there is no water, we are trying to find the water. If there is mild water, we are doing like this to absorb water. Exactly, teeth is doing the same thing. Huh? Okay. Then second, the teeth mark also not only in the same area. Teeth mark also in different area. Okay. So where is your mucous layer is damaged more? In the lungs, the liver, in your spleen. In that area you will find little bit more teeth mark. Mostly it's happen on the side of the tongue only, but sometimes it comes on the lungs, because lungs also having the like sinus, the mucous cavity. If the lungs mucous cavity is damaged, then we'll find the more teeth mark on the lungs. Sometimes on the heart, very few cases on the heart too. But maximum you will find in the spleen and on the liver. Okay, but remember that formula: liver absorbing, okay, and functioning more on the vitamins, and the spleen is more on the minerals. Okay.
So it is just deficiency. It's not that the spleen is not capable of doing it. It's just deficiency.
When there is vata, excess vata in the spleen, so when you are eating the zinc and magnesium, your spleen is not able to absorb.
That's right.
Because for absorbing, you need the same product inside your body.
Yes.
But the product you don't have inside your part, and how that will absorb?
How do you know if it's an absorption issue or a deficiency issue?
They both are the same.
Also, from a solving perspective, there is-
See. This is the spleen. This is the spleen. When you have the enough amount of the like zinc and magnesium, okay, through that the spleen is produce some chemicals and some acid structure, which is going to your pancreas and going to your stomach. When you are eating something and in that product, if you have the zinc and magnesium, okay, then this chemical will come, they will break down and they will help to absorb and take in a small intestine. Understand? But if your spleen is not able to produce, they don't have the enough like zinc and magnesium, so when this food will come in your stomach, then the chemical is not coming because of the deficiency. And now in these conditions, your body will not absorb that product. what we discussed, if you are eating the sweet taste, okay, you have more craving, you are eating the sweet taste, but only your taste gland on your tongue, if the sweet taste is not coming because of the deficiency, then you are not able to absorb it. Okay, so in these conditions, what we call the deficiency of the zinc and magnesium and absorbing and assimilation issues. Understand?
So in the sweet example, if I have my heart is dry and my heart needs the sugar, when I eat the sugar, that is adequate. Even if I am, so it won't be that. Only the excess sweetness will go waste. Otherwise,
Yeah,
my
excess
basic
sweetness is bad. Normal sweet is good.
So now even if you have a dry heart,
Whenever there is dryness,
it's
there
okay
is
to eat some sweet.
yeah. So your body will demand to automatically sweet.
So you should eat that sweet.
Normal sweet is good, but
Excessive is the problem. Then it goes to the other organs and messes it
yeah,
up.
and mostly like growth, which is the natural sweet is more effective.
Yeah, of course. That goes with that.
Okay, clear or not?
You're saying that it produces chemicals that help to make the zinc and magnesium more absorbable in the intestines,
Yeah.
but it doesn't actually so absorb the zinc and magnesium.
Yeah.
The liver doesn't. It just produces the chemicals that help to make the.
No, if they don't have enough zinc and magnesium,
They won't produce the
they won't
chemical to
produce.
begin with.
If they will not produce, if you are eating, then they will not absorb. Because for absorbing, you need that chemical no to break down and absorb.
So then the question is, how do you solve it? Because by eating you can't solve it.
No, in these conditions, for example, same thing happened with iron. When we come in the next one, then we have the iron deficiency. In this iron deficiency, taking the patient medications for a long time, but their iron is not on normal range.
They're not absorbing it.
It's not absorbing.
So absorption, you have to
Absorption is more important. What you are eating, how much you are eating, that's not more important. How much is absorbing, that's the more important. In these conditions, what will happen? This food will come here, this will eat for long time. Still, they are demanding for chemical, but your spleen is not sending because there is not enough chemical. Then you stagnate more long time, and if not, then they will maybe start to reflux, or maybe they will go in your intestine, and without absorbing, without mixing with this chemical, your intestine will not separate your zinc and magnesium. Then that will pass through your toilet. They will not absorb. When you are eating something, now the zinc and the magnesium, some chemical are here. When you eat something food, in this food you have the magnesium and the zinc both. But when you come here, but there is no chemical of the zinc and the magnesium. In this condition, if this chemical is not mixing with this one, okay, then they will stay for a long time here, waiting for the chemical. But still, if they are not coming, then they will start to reflux because undigested food that one. Okay, and if your stomach is little bit strong, maybe they will pull in your intestine, but in intestine will not absorb. Without chemical, if your intestine will send to the nutrition protein to your liver, that means that is raw material. Without mixing with this chemical, if the zinc and magnesium going to your liver, that is the raw material, not absorbable. That will create lots of the problems inside the body. So that's why the body will not absorb this, and body will not separate this zinc and magnesium. They will send directly into toilet home, go out. But when we are taking a tablet is like processed one. When we are eating the food takes lots of the time to break down, absorb. It's the micro process. But when you are taking the tablet is directly pure, like already like the form of the magnesium and zinc. So that for this tablet it takes very small amount of the chemical, from the spleen, and then they will absorb very easily.
That's how it will fix itself.
Yeah.
So
once the tablet circulation is going in our body and coming back to your spleen, then your spleen have enough calcium, enough magnesium and zinc, then spleen will produce more chemical, then your body will be able to absorb it.
So some of the absorbed zinc and magnesium in the small intestine goes to the spleen so that it can produce
After
more
the
chemicals.
process, after the like zinc and magnesium going in your intestine and going to your portal vein and liver,
Yeah.
then they will circulate in your all over the body. After the all over the body, the essence will go in your spleen.
Okay.
From the essence, the spleen will produce the mucus, chemical, lymphatic systems. Okay, they will go in separate regions. But first, they will go in your muscles. Then slowly come to your bleeding.
In other words, zinc and magnesium supplement if you have deficiency will help.
Yeah. In the spleen deficiency, zinc and magnesium help a lot. That's why it's giving you more for muscular problems. It's giving for someone having the constipation issues.
Well, it depends on what type of magnesium or zinc as well.
Yeah, I'm talking about only zinc and magnesium. Then there is a lot of the different subject. Okay, and it's giving for healing also. Zinc also help to heal because of
Immunity.
Yeah, immunity. Okay, zinc help to heal. No, some like diabetic non-healing ulcer, doctor used to give the zinc.
Oh, the healing.
Yeah. Okay. So in this condition, what we do the simple protocol.
Zinc.
We do the protocol to reduce the vata from the spleen. What protocol we are doing?
Reduce
There is the excess vata in the spleen. What we'll do?
Oh, there's standard.
Reduce the spleen vata and increase the kapha. Kapha means the lubrication in the spleen. We'll use the point. First we'll discuss on the symptoms.
Same wind remover will help to reduce the.
No, wind remover is all over the body. Now what we are talking
Only
is only in the spleen excess vata.
Okay.
Only in the spleen excess gas.
So we have to reduce the needle will reduce the excess power.
Yeah.
So we're gonna reduce the excess gas in the sticks.
Yes. Then it will become more efficient. Also it will give supplements instead of.
Okay, if there is a teeth mark on the tongue, what other symptom you will see? What is the function of the spleen? See, the spleen.
Reduction
See,
of white blood cells.
yeah, spleen is governing your muscles too. The muscle strength. Okay, spleen like your kidney is governing your bone because the absorption of the calcium that comes from your
Skin.
calcium. Kidney calcium.
Or
Okay.
Yeah.
The calcium we use, the maximum amount of the calcium we use for which tissue?
Bones.
Bones.
Bones. So that's why I say like bone is governed by your kidney and muscle is governed by your spleen. And cartilage and disc is governed by your liver. Because collagen production comes from the liver, magnesium and the zinc production comes from your spleen. Okay, so whenever your spleen becomes weak, of course your muscular density becomes less. Spleen is govern your immune system also. The spleen is govern our immune systems. Then there will be low immunity.
That's why zinc is needed for the immunity.
Yeah. Okay.
So say that again. Spleen is governing
Muscles, immune systems. Okay, and spleen is govern your white matter in the brain. Spleen is govern white matter in the brain.
What's the difference between the white and grey matter?
Both called one thing, one beginning. Yeah, but please, whenever you come, please text first, then come. Okay. Yeah, they control the different nerve system. They control the different temperatures, and they carry different informations. We discuss like EDA is like the storage of the informations.
So
Pingla is bring the
so
more
white is
information.
EDA.
Huh?
White is EDA then, right?
Yeah, white matter is EDA, grey matter is Pingla.
Parasympathetic.
Okay, that's good, yes.
Okay? And the spleen is help for digestion too. Because in the intestine we have mucus layer. Who built that mucin mucus layer?
This zinc and magnesium.
Yeah, spleen.
Spleen.
Spleen is built your mucin mucus layer. Okay. Yeah, mucin mucus. In the intestine we have this mucin mucus, no? This is it built by your spleen. When your spleen weak, then your intestine contraction and relation capacity become
Yes.
weak. So that's why zinc is helping to improve your digestion system also. When our digestion system is weak, doctor used to suggest zinc. Take these zinc to you will improve your digestion system. So actually that is improving your mucin mucus layer in the intestine. Okay, so when mucin mucus layer become the weak, not able to contract and relax properly. Okay, the last emotional thing, what will happen? What emotions?
Worry.
Worry.
Anxiety.
Anxiety, worry, excess overthinking. Excess overthinking. Okay, this whole symptom will come on the teeth mark. Okay, with the teeth mark, then we diagnose the different pathogens on different part of the organ. So like that whole, when we learn the whole tongue, and with the tongue we do the pure diagnosis. Pure diagnosis means, for example, this person is having the teeth mark, right? This teeth mark, there is a color also, and you see the black dot of the color, and with this the tongue is become the mild yellowish. Okay, so we do the whole complete diagnosis where the patient is having the what types of the symptoms. As per that, we decide the protocol. What treatment will do? What protocol? GT is very common. We'll do GT. With the GT, what will add more?
Liver 13. Liver 13.
You can add that. That's a good move. Point of mostly, for example, this type of the case, we do the origin treatment with the Bexu point. Bexu point is more effective for your solid organ. Okay. If you are doing the front point, then what we'll do is spleen 1. Write the spleen 1. GT plus. Okay. General tonification. General tonification plus spleen 1 and spleen 9. Spleen 1 point is for your Vata and spleen 9 point for your Kapha. Everyone knows where is the spleen 1?
No.
No? This is the spleen 1. Here.
Oh.
Okay? Here. This is the spleen 1.
Corner of the toe.
Yeah. Very effective point position is. Okay. Vata point is effect very fast.
Yeah.
Yeah.
And
On this side.
left foot is better.
Huh? Yeah, spleen is on left side. That's why we target on left side. This is the spleen 1, and where is the spleen 9? Who is wearing short? It's actually here.
Spleen 9.
Yeah. How we diagnose? See, inside the tibia bone, and I'll send you the proper PDF of the each and every tongue protocol. Okay? This is just to build your brain more strong. But end of the tongue diagnosis, I'll send you one tongue tick mark. What protocol will use? One tremor tongue. What protocol will use? Okay? Each tongue, their pictures and symptom you add through your pen letter to revision, and I add the full protocol. So that is for your revision. But right now, just use your brain more, so that will help more fast. See, this is the like one. This is tibia bone, right? So when you're going here, this is the curve. Inside the curve, here.
Curve.
Yeah. Like this is tibia going down like this, right? Where is end? This is the spleen 9 point.
So, but not
Just exactly center of your leg, and just below here point.
so it is like quarter tune or half tune away from the bone, end of the bone.
Or the crease.
On the bone. This is the point on the bone.
On the bone.
Yeah.
So it's
It is
Down
on,
between.
Medially, it is medial side.
on the medial side. Okay. Here. Okay. You will find this small
So even with
gap there.
Yeah.
When you go like this, you will find a small gap here. This one is here. Okay. On the bone, okay? This version.
yeah.
Okay? And here, this is here, and then liver here on the here. That's very liver kapha part. Okay?
Yeah.
Yeah, GT plus these 2 points. GT plus these 2 points help a lot for your teeth mark.
दो पॉइंट्स डाले
your right leg.
Sorry?
That's your right leg.
Yeah, but it should be left.
GT plus zero
It should be left.
Yeah, because the spleen is on the left.
Yeah.
Preferably. Even this one, ST1 should be on the left.
Okay. So that dot should be on the other one.
Yeah. So both ST1 and 9 on the left leg, right?
Those
Preferably.
both left leg.
Okay.
The spring on the left side, no?
Yeah. This is the, yeah, it's the shoe point. Shoe point.
Which point?
These are all shoe points.
No, that is all distal points.
Distal.
Shoe point means that shoe and move point means on the organ point.
Oh, I thought move was
On, and shoe
was
was-
behind.
Move is the front on the organ.
Oh, but
Shoe is the from back side on the organ.
Oh, okay.
I understood. Okay, these are distal ones.
Yeah.
Got it, got it.
This is the SC9,
ST9 and that one is ST1.
SC1.
This is ST1.
Whenever you use
Oh, it's
needle
in the
for the
middle.
No.
whenever you use needle for the spleen
Right
one
side,
and on the
side.
tip, no, just use inserter. One prick, that's enough. Do not stimulate. Do not touch the needle. Okay? Very painful. Trust me.
Only
First try on your own self, then try on patient. So you will remember that.
GT.
We
When
do
when we insert the needle on the
that
tip, no,
of the big
just
toe.
inserter, one prick. That's enough.
Okay.
Also, for my left foot, it is towards the other toe, right? This corner. This corner or this corner?
Outside.
There is liver.
And this corner.
Okay. Yeah. This is the spleen one,
Okay.
and this is the liver one.
Ah.
So the spleen is the outside,
This.
Yeah. Outside means medial side. This side.
medial side.
Yeah. Outside is this one.
Lateral.
Yeah.
So it's the lateral side.
No.
Medial side.
Medial side.
Oh, so it's the inside.
Outside is lateral side, no?
Outside
Medial
lateral
side.
side. Okay.
Yeah, lateral side. Medial. And medial is
So which one is
liver
it?
one.
Lateral and medial. It's the outside corner.
Liver something.
Medial.
It's medial. Okay. Medial.
And the whole body has to remember, right?
This is this. This is this.
Yeah, liver is solid.
Cha-cha.
Liver is also